established in 1963 as a Florida not-for-profit corporation, LeadingAge Florida is committed to assisting members in achieving excellence as providers, businesses, and employers. Big job. Anywhere, but in Florida, yeah, especially. To accomplish this goal, the association provides up-to-date regulatory information, a wide variety of educational opportunities, representation before the state legislature, and government agencies, group purchasing, that is to say group purchasing services, and opportunities for networking with peers. All of this under this one umbrella that serves 250 mission-driven communities and representing more than 500 facilities and 140 business associations. It's a big job. We're fortunate, I think, in that for those of us who are approaching seniority, we have an organization of this kind that is, in some respects, precariously balanced, I suppose, between the wants and needs of its membership and the communities they serve against or along with the needs of individuals, people who are just looking for good care. Now, saying all that, we have one person who is responsible for the success or failure of this entire organization. He stands in the watch. Steve Bahmer is our guest this morning.
I stand on that wall for you, Brian.
That's what I was told.
Yes, indeed.
Yes. And by the way, I can handle the truth. Okay, so you just lay it on me, pal.
We'll get some of that today.
The last time we talked, and it's been a while ago, I recall leaving that conversation and thinking, we're in a heap of trouble because there are at least I think there was at least 3, maybe 4 competing sort of inevitabilities. The rising expectation that we all are subject to. I mean, I want the life I've been living now with my, cellular abilities and my digital abilities and restaurant quality food. I mean, you need to take care of me, sure. Right? And that rising expectation seems unlimited, I suppose, endless. Meanwhile, the funding of all that becomes even more sort of treacherous and challenging and imposing, and in between or in the midst of that are all of these then senior care facilities at various levels of care, but fundamentally they all end up having to at least provide living space at a cost that is affordable. Oh yeah, and then there's that third leg that says who or what is going to pay for all of this?
Right.
The end user, his or her family, the insurance companies, you and I, the government, or what? So, here we are today talking again about all of that sort of confluence, and I understand that you've got some better news for me.
Well, I certainly hope so.
Okay.
So, those problems fundamentally haven't been solved, and you wouldn't have expected them to have been solved in the last 12 months, I don't think. It took us a long time to get here. It's going to take us a long time to get them resolved.
Indeed.
But there has been progress in a number of areas. I think probably the most substantial progress we've made is in the last 2 weeks even. 3 of the largest organizations focused on senior living, both in terms of the providers, which is who we represent, as you mentioned, and consumers, seniors themselves, have come together, and we have formed what we're calling the Coalition for Silver Solutions. And I'd like to talk to you a little bit about what that means and what's driving that. But at the end of the day, LeadingAge Florida, with our 250 members, the Florida Healthcare Association, with about 500 members, and the AARP of Florida have joined together to work on a comprehensive blueprint to bring to the Florida legislature in 2020 to outline not the problems. You've described the problems, and we've talked about those before. They're not hard to find. But our idea for comprehensive solutions, so funding reimbursement is part of that. Workforce is part of that. I think if you asked our members what is the issue that keeps them awake at night most, it's that they just can't find people to staff their communities to provide the service. So we'll be talking about workforce and staffing issues. We'll talk about the regulatory environment, which you and I discussed last time around. Where there are regulations that cause additional burden without resulting in higher quality levels, maybe there are ways for us to take a look at that regulatory environment.
Okay.
And the plan is for us to bring all that to the legislature in 2020 so that we're taking a longer term view at the challenges that face Floridians in terms of caring for seniors and bringing some solutions to the table. It's pretty exciting news.
As the country goes, is it fair to say that Florida has an abundance of seniors? I mean, aren't we known as sort of the retirement state? Certainly this community is known for its retirement advantages. In fact, there are some private groups that are soliciting that. They want
Sure.
more people to choose Tallahassee, I think
Right.
it's referred to.
Right. Yeah, certainly Florida is the grayest state in the country. And these numbers they're well known to us in our field, but on an average day-to-day basis, you might not think about it. Today, about 1,000 people a day move into Florida from elsewhere. So if you think of it in terms of a city the size of St. Petersburg moves into Florida every year.
Right.
Today, about 1 in 5 of those people is 65 and older. By 2030, it'll be 1 in 4.
And I raise that as a topic because if we're talking to lawmakers, one would say, we're the grayest.
Right.
This is a big deal for all of us as Floridians. Is it not a big deal for you? So do you find yourself having to sell that idea? Do they not immediately get it, or I guess what's been your experience? I mean, they're way ahead of you on this, or?
Well, certainly the legislature in Florida is thinking about it and dealing with senior living issues in pieces. And what we want to do is bring all of those pieces together in a comprehensive plan. And if we have some time, I'd like to talk to you about one example at least.
We have plenty of time.
That kind of shows how all the pieces
Absolutely.
are connected.
Take as much time as you need.
Well, and I think that's one of the things that's unique about LeadingAge Florida's position in this coalition is
You
that
have 3 minutes. I'm just.
I was going to start at the beginning. In the beginning, we represent the entire continuum of care for senior living. So whether you're a low-income senior who needs an affordable apartment but no skilled care, or you're a wealthy retiree from the Midwest who wants to live in a luxury retirement community, you're a member of ours. And so we have a view of the challenges that face senior living that's much broader than our partners in this coalition, and I think that's unique, and we can talk about that. But to your point about it being a big deal, it's almost as though you read the press release, Brian, because we announced this coalition at the Capitol a couple of weeks ago with Florida Healthcare Association and the AARP, and Senator Al Britton was a sponsor of a senior living bill this year, which is not going to pass, but he introduced the coalition at that press conference, and he said multiple times, folks, this is a big deal. These are organizations that don't always agree on the solutions to senior living issues, who have decided that solving these problems is bigger than whatever historical disagreements we've had, and we're coming together to do it. And he said time and time again, let this not be lost on you, this is a big deal. So I think they get it.
And for LeadingAge, your members are not individuals as such.
Right,
You
that's
represent the providership side.
Right.
And then you have other organizations like AARP and others that are really advocates for the individual, right? Is that fair?
That's right.
Do those organizations as entities then converse with each other? Are you guys in touch with AARP on a kind of day in, day out basis, or how does that work?
I would say not that frequently, but
Because I mean, you each have your own, constituents, we'll say, and,
Right.
and objectives and things that you've got to carry out. But I was just curious to think, well, how well do you guys connect or check in with each other? Like, man, that's a really great idea, and they hate it. So.
Well, we talk a lot, and as I said, we don't always agree on the solutions to the various challenges that we face. But this is a very different kind of conversation for us. So you mentioned in the intro the precarious balance. We represent the providers who are trying to deliver service. AARP represents the recipients of those services. What's unique and sort of a driving force for us is that our members, as you said, are mission-driven organizations, which means largely nonprofit, very interested in delivering the highest possible quality care in the right setting. And so our members prosper when AARP's members are happy and satisfied with the service that's being provided. And so there is common ground there.
There is a common agreement. Folks, we're talking with Steve Bahmer. He is the executive director for LeadingAge Florida, caring for Florida's seniors through all of these various organizations, businesses around the state. You stay with me, we're learning a whole lot, so don't go away. Back now talking with Steve Bahmer, LeadingAge Florida Executive Director, how we get through, how we navigate past these sort of mind-boggling objectives, I guess. How do we continue to maintain a level of care, and that just seems to accelerate, right, as you go forward. And so, interestingly enough, when hurricanes come along or some other natural disaster, and a facility finds themselves on the short end of that whole process, and there's one in mind that we all think of regarding air conditioners, right? And
Unfortunately,
the governor jumps in. It was horrific. And where were you that day? It's like asking you, where were you on 9/11? That had to be a day when you were like grabbing your head and grabbing the phone, and what a terrible incident.
It was horrific, Brian, and of course I know exactly what you're talking about. And it was one of those situations where, look, no, we're not naive. Nobody wants to live in a nursing home. That's we hope we all live long enough to need some care in our old age, but we recognize that in general, folks would rather age in place. We have a new study out recently from our national organization in DC that demonstrates something we all know, and that is that seniors would rather age at home. Unfortunately, that's not always possible. So that situation in South Florida has the effect of painting the entire field with one very large, very dark, unfortunate brush. And so I do remember where I was that day, and I remember the ensuing arguments very well about getting generators implemented, and you've known our position from the beginning. That was the right thing to do. The governor at the time didn't allow enough time to get that done in a safe way, but it has always been the right thing to do to make sure that the facilities are in place to keep seniors safe in the case of an emergency.
In those situations where you find a provider, we'll use that term loosely here, because as you've described, that's a wide range of providership, right? From luxury resorts down to maybe a trailer park or something. But I think when it comes to providership, what does LeadingAge do to try to better protect, I guess, the public, or better ensure that your members are adhering to a set of standards? How does that work?
Sure, that's a great question. So I think most people are familiar with the public quality reporting mechanisms, the 5-star method that's used for nursing homes and that sort of thing. So that's sort of the public ability to gauge quality as measured by CMS. What we do is the educational programming that you talked about before. That's the role we play in making sure that our members know and understand what the latest regulatory changes are, and they're prepared to implement them effectively. So, pardon me, we'll do 50 educational programs a year, and the reimbursement system for nursing homes, the federal reimbursement system, is about to change again in October, and we'll spend almost all of this year getting our members ready for that so that they understand it. We did the same thing with the generator rules, with federal disaster preparedness rules and those kinds of things. Our members take their responsibility to care for seniors as seriously as anything, and we take very seriously our role in helping them understand what is the lay of the land, and what do they need to do to get prepared.
It's remarkable too, and I say this because for those of you who are listening, and this is maybe your first time to realize that there is this nonprofit association. I mean, this is not a government-funded bureau here, right? These are folks who, by their choosing to have associated themselves in this fashion, pay in so that they can better do what they intend to do. Isn't that a fair statement?
That's right.
So LeadingAge Florida members, and it says right here on this piece of paper, because I got this from my staff earlier, are economic engines providing an estimated 25,000 jobs statewide, and they're sponsored primarily by community-based, non-profit, civic, religious, fraternal, and other mission-driven organizations. So in fact, for those of us who say, I'm really, I don't believe in government regulation, a bunch of bureaucrats telling me, how many times a day I can flush the toilet. Well, wait a minute. This is private enterprise coming together in a way that works to better improve the standards. And you're then in that role of communicating back to your members to say, okay, here's how this is going to work. This is how you need to play this game. This is where you need to be professionally. If you're now, do they risk being penalized or disbarred from being a member of LeadingAge if they're in, maybe they're getting a 1-star rating or something?
That's a great question, and we try to be careful about that because we think we can be helpful. If there's a provider that's in trouble, that's not providing quality care, we think we can be helpful in getting them on a path toward improved quality, and ultimately that's what we want.
I mean, do you reach out to them and say, hey,
absolutely,
we're here?
Absolutely, and we have resources that we send out to them, experts who can help them resolve the issues they're facing. But I would also say that one of the things that's unique about our organization is that you have to have a commitment to getting better. We don't have members in our organization that are 1-star nursing homes and that are fine with staying that way. We just don't. That's not the culture. Doesn't fit with the values of our association.
I know you do some ongoing continuing education, as it's referred to, for those who are providers along a lot of different topics, right?
Sure.
So tell us a little bit about that.
Sure. So as we talked about before, a lot of our educational programming relates to changes in the law and changes in regulation, and what does that mean for you? So as I mentioned, the way that nursing homes get paid through the federal government will change again in the fall. It's a dramatic shift, and so we'll spend this year educating on that. We spend a lot of time training on clinical issues, fall prevention, infection prevention, those kinds of things. It's been several years ago now that the Institute of Medicine produced its report that showed, the primary cause of infections in the hospital environment is clinical workers who don't wash their hands. So we spend a lot of time on those kinds of clinical issues. We also spend a lot of time in continuing education with our members on business practice. I fall into this trap sometimes. Our folks are driven by their 501c3 nonprofit missions to care for seniors. And sometimes what gets lost in that is that these are businesses with employees and HR issues and finance issues and those kinds of things. So we do a lot of
some of your
education on
members
that.
are nonprofit, but most of them are a for-profit enterprise. Is that right?
It's the reverse.
Oh.
Most of our members are nonprofit. We have
and then some that are
some
private.
for-profit.
I
right.
see.
All private, but some private nonprofit, some private for-profit.
I got you. Okay. Yeah. And in that respect, and we can talk about this as we close out here, if I'm looking for care for my parents, LeadingAge a good place to start? If I come and talk to you guys and say, she lives in Tampa, we're thinking about moving her up here to Tallahassee, can you give me some kind of direction, some advice, people that I should talk to here locally if I need your help?
Absolutely. It happens all the time, and we're very happy to do it. We need some parameters, and we can connect you with the highest quality providers in the state of Florida, and we're very happy to do it.
Okay. I'm going to say immediately on that note that there is a website that we should go to, or you could just call Steve at home. I'm sure nights or weekends are acceptable.
Anytime. I'm always
happy. Your personal email. your phone, your cell phone number, right? Can we just text you?
Sure,
Is that
text
okay?
me,
Sure.
Instagram,
Yeah,
whatever you
okay,
choose.
Okay, you should see the look on his face right now. It's like, yeah, you funny guy.
I thought for a second you were actually going to say my cell phone number.
Well, you know, I've been known to do stupid things, right, Carl? Yes, Carl's in total agreement. So anyway, we have a website, folks. What is that? LeadingAge.org?
LeadingAgeFlorida.org.
There we go. LeadingAgeFlorida.org. Don't bother him on the nighttime and the weekend and the cell. No, don't do that. Go to the website, full of all kinds of good information. And then you can reach out to them if you want to by phone or email. They're in their offices right here in Tallahassee.
Absolutely.
That's why it's easy to just snag you. We grab you in here and you talk with us at length and put up with my nonsense.
Oh, I'm always happy to have the opportunity.
We
Brian.
appreciate it, Steve.
Thank you.
Thanks. God bless you guys and all the things you're doing for all of us and all of the seniors in Florida. It's a good thing.
Happy to do it.
We'll
Thank
see you again soon. Folks, that's what I've got for you today.